All right, I think I'll kick us off. Good morning, good afternoon, good evening to everyone joining us. I'm Kelly Rogers. I'm the editor of DevX's The Aid Report. I spent many years reporting on women's health and rights, and I'm glad to be here with you today to guide us through a discussion called A Year of Harms: The Global Impact of Humanitarian Funding Cuts on Women and Girls, organized by the Women's Refugee Commission in partnership with the International Planned Parenthood Federation and UN Women. Before we get too far down the line, I want to alert you that we do have interpretation available in Arabic, English, French, and Spanish. And so if you look for, it's either a globe icon or a more button at the bottom of your screen in the menu, and you can choose your preferred language there. And if it's the more button, you'll click more and then interpretation, and then you can choose your preferred language. So most of our panelists will be speaking in English today, but we do have a panelist who will be speaking in French. This discussion is about what happens when funding decisions collide with lived realities. Across humanitarian settings, US aid cuts have reduced services. They have destabilized protection systems that women and girls rely on to survive violence, displacement, and crisis. So today we'll look at what the data shows, how those impacts are being felt on the ground, and what this tells us about what is next. I mentioned that I'm the editor of the Aid Report, where we've been really busy and dedicated to tracking the impacts of the US foreign assistance cuts across geographies and sectors through original reporting and aggregated data collection. And we've just put out a downloadable report, in fact, that collects some of the cross-cutting trends that we've been noticing from the data that we've collected so far, including destabilization of national systems used to measure things like hunger, monitor health trends, and guide resource allocation. And also the many ways that the closure of one program or seemingly one program often produces effects far beyond its original sector. And so it would be impossible, I think, to talk about these cross-cutting impacts without recognizing the outsized effect on women and girls. One of the things that has come through really clearly in our data is the closure of safe spaces. So these trusted local centers where women and girls could seek protection, counseling, and referrals. And so the loss of these centers dismantles a protection network that connected them to things like education, health, and psychosocial support services. So there are countless knock-on impacts, and I know we'll get into all of this in more depth with our panelists that we have with us today, who I'll introduce in just a moment. But first, one last housekeeping message. Just a note that we will have plenty of time for questions after we have our moderated discussion. So please use the Q&A box at the bottom of your menu to submit your questions, and feel free to do so as you think of them. And I'll be sure to scroll up and start there when we get to our Q&A session. And also feel free to direct those questions to a particular panelist if you'd like. I encourage you to use the Q&A box for panelist questions rather than the general chat. But if you do experience any technical issues, please do use the chat, and it's enabled for help, and we'll try to jump in and help you with that. But for now, let me move on and introduce our speakers that we're really lucky to have here with us today. So we have with us Julianne Deitch, who is Associate Director of Research for the Women's Refugee Commission, which recently released a report documenting the global impacts of the US aid cuts on women and girls in humanitarian settings. We welcome Olha Averina, chairwoman of the board of the NGO Unity Platform in Ukraine, which is a local organization that works to provide safe spaces to women and communities affected by the war in Ukraine. A note that Olha is joining us from the front lines in Kharkiv, where they are experiencing severe limitations to internet connectivity. We have other colleagues on the line who can step in if we are misfortunate enough to lose Olha and her connection. We also have Dr. Fateh Rezul-Kilinch, a Gender and Humanitarian Action Program Specialist for UN Women, where he leads efforts to integrate gender equality and women's leadership into humanitarian coordination. We have Abadi Kalayu, who is an Executive Director at the Family Guidance Association of Ethiopia, which has provided sexual and reproductive health care to vulnerable communities across Ethiopia for 50 years. And last but not least, we have Jolie Coco, National Coordinator at Action de la Femme pour le Développement, a local women-led organization from the Democratic Republic of Congo, which works to support survivors of sexual violence in Eastern DRC. You might have noticed from that brief attempt, I myself sadly do not speak French. Jolie will be speaking in French, and so if you need to, please use that interpretation channel during that time. But for now, I'd love, and I see here that our colleagues have dropped the full bios in the chat. So if you're interested to look more into these folks, please do that there. But for now, let's jump in first. And I want to begin this conversation by talking about impact. Julianne, I'll turn to you first. I know that Women's Refugee Commission research has showed that gender-based violence programs have been among the hardest hit by US aid cuts. In fact, one figure that sticks and kind of is burned into my mind from your report is that nearly 400 million in US funding specifically for gender-based violence programming has been terminated since January 2025. And I know this is one of many impacts. So based on your analysis, what has changed most dramatically for women and girls since early 2025? And why are these cuts particularly destabilizing in humanitarian settings? And welcome.
Sure. Thank you. Thank you, Kelly. And you already spoke so eloquently in your introduction about some of the many devastating impacts that we've seen over the last year. And like so many other organizations, WRC has been interested in monitoring the impact of foreign aid cuts on women and girls in humanitarian crises. But what we've realized is one of the challenges has been that the evidence is really fragmented. So oftentimes reporting is not gender disaggregated. Many figures that we see coming out are projections or estimations rather than real observations of what has happened. And also the documentation of impacts is dispersed across sectors, regions, and different types of publications. So this makes it difficult to see broader patterns. And it also, sorry? I thought I just heard
Oh, we
someone
might have
say
just had a
something.
hot mic, but I think we're okay. Go ahead.
Okay. So this makes it difficult for us to see broader patterns and understanding really how the funding cuts are shaping the lived realities of women and girls in humanitarian crises. So toward the end of last year, recognizing this need to bring together evidence, um, we we conducted a scoping review. We did that to identify cross-cutting trends and patterns, as well as evidence gaps and priorities for research and advocacy. And if everyone could just make sure their mic is muted, I don't know what I'm hearing. I'm hearing something. Um, so WRC published in January what, to our knowledge, is the first and most comprehensive global synthesis of evidence on how U.S. foreign aid cuts have impacted women and girls in humanitarian crises. We conducted a scoping review, and that yielded 105 published resources from humanitarian crises in 32 countries. And what emerges is quite clear in terms of the billions of dollars in humanitarian aid that were cut overnight. And we found evidence of the consequences for women and girls that have been immediate, multidimensional, and in many cases, deadly. So I'll just highlight a few things and try to touch on what you asked, Kelly, about why is this particularly important for women and girls in humanitarian crises. So the first major finding was that women and girls have lost access to life-saving healthcare. So across many different types of crises, we saw very clear evidence that clinics have closed, there have been reductions in mobile outreach, supply shortages, and the loss of trained healthcare providers. And in humanitarian settings, this is especially consequential as these services were often the primary or only accessible source of healthcare for women and girls. We know that maternal mortality in humanitarian crises is the highest in the world, and we did find evidence of maternal deaths that were directly attributable to U.S. funding cuts in Afghanistan and Yemen. And I'm sure, there are many other examples, but in terms of the published evidence, that's what we found. The second key finding is also what you mentioned, Kelly, of girls and women being less safe from violence. So, US humanitarian funding to the GBV sector fell by nearly 80%. Our report documents these widespread disruptions to GBV programs and services. You mentioned safe spaces. We documented, the closure of hundreds and hundreds of safe spaces, which are often the only entry point for survivor-centered care in humanitarian crises. And beyond that, we also saw evidence of reduced capacity for case management and GBV prevention programming. So not only are services ending, but funding cuts are sending a message of impunity to perpetrators. And it's also eroding years and years of trust building that GBV programming has done with GBV survivors and communities. The last key finding I'll mention, which I know we'll be hearing more about from our panelists, I'm really, really glad that we will, is that women-led organizations have been particularly impacted. We know from a UN Women Survey that was conducted in early 2025 that half of women-led and women's rights organizations in humanitarian settings were expecting to close in 2025, and that's as a direct result of US funding cuts. So our review substantiates this finding from last year. We found that these closures are compounding harm for women in two ways. First, women and girls are losing essential services that these organizations provided, and they're also losing this critical civic space, so the ability to mobilize, advocate, and influence humanitarian decision making at precisely the moment when we need their voices the most. So just to end, a key takeaway also from our findings is that this review is not in any way fully capturing the extent of harms for women and girls. We have found significant evidence gaps, particularly around the gendered impacts in sectors that aren't quote unquote like woman focused. So there's not a lot of evidence on the gendered impacts in, for example, food security and nutrition and WASH. And it's only been a year, so the longer term impacts are yet to be seen. And this is especially consequential for looking at the impacts on gender equality outcomes. These remain largely undocumented. We also know that with funding cuts to research activities, we face a risk that some of the most enduring harms to women and girls will remain invisible until they're very, very deeply entrenched. I also want to note that the majority of our evidence from the review came from organizations and institutions, including ourselves, that are based in the global north. So while our synthesis provides a critical documentation of global trends, we're also aware that it's just so essential to hear from frontline organizations that are navigating these challenges in real time. We also recognize that this is coming at a time where organizations are asked to do the impossible, right? And being asked to do more and operating under immense strain. So I just want to say that we're so deeply grateful that we have our panelists with us that are working directly in crises contexts and witnessing firsthand how the disruptions are shaping or reshaping daily life for women and girls that they work with. So thank you. And with that global overview, I'm really looking forward to hearing more from our panelists on the impact of these cuts.
Thanks so much, Julianne. And thanks for also highlighting, the importance of women and girls losing those essential civic spaces. That's something that we're seeing at the aid report too across sectors. The loss of those spaces where people could gather and have dialogue or, conduct referrals or receive services is really consequential. And I agree. Considering the fragmentation of evidence, it's really hard to know all of the knock-on impacts. So thanks for bringing that to the forefront. I'd like to go now to Fateh. I'll turn to you because I know you've conducted research at UN Women Ukraine that involved a survey of women-led organizations across the country. So I wonder what stood out to you from that work in terms of what you learned about impact in the country.
So, dear Kelly, thank you so much. Yes, we have conducted this research, the impact of funding cuts, especially on women-led and women rights organization in Ukraine. We conducted the first research in February 2025, and we wanted to understand the trends and the changes 1 year after the suspension of the funding cuts. And we recently finalized our second research. It was basically last week. I mean, the data is extremely fresh. Unfortunately, the results are very depressing for women rights and women-led organization. And of course, I don't need to even mention that almost all of these organizations are working in the humanitarian space. So according to the data, 85% of the women rights organizations have been either severely or moderately affected by the funding cuts. Another, I think, important aspect that we need to mention here, according to the very, very conservative estimates, because of the methodological constraints, we were able to identify like almost around 70,000 women and girls are not going to receive services provided women and women rights organization in Ukraine in 2026. But again, I would like to emphasize these are the very conservative estimates. On average, why they are unable to serve because of the funding cuts. On average, we have identified almost $300,000 to $400,000 each woman-led or women rights organization lost in 2025, and they are expecting to lose the same amount for 2026. And everything is, of course, connected to each other. It was a very, very challenging year for women rights and led organization in Ukraine because when we accumulate the results on the impact of funding cuts on staff, those organizations lost in total 570 full-time or part-time staff. So, which basically means because our population of the survey sample was 108, it means on average each organization lost six to seven staff members, either working for full-time or part-time. And it's going to continue. The effect is going to continue, it seems, in 2026. They are expecting to terminate at least 3 to 4 for our part-time staff contract, which of course basically is going to impact their delivery. When we look at the areas, the programmatic areas, which have been the most affected, and we see a similarity between 2025 and 2026. These are GBV, prevention response, and MHPSS under like protection activities, and also women economic empowerment and livelihood. So these are the most affected program areas in Ukraine. And when finally look at the beneficiary profiles, and unfortunately, I mean, this is also another distressing kind of finding. Again, the most vulnerables are going to be left behind because of these funding cuts. Because when we look at the profile of the beneficiaries, elderly women, women with disabilities, internally displaced people, and single mothers. These were the top 5 beneficiary types who have been affected by the funding cuts in Ukraine. And what is more alarming, I think, if I have like one more minute, increased competition between women rights organization, and there is a huge kind of shared understanding between women rights organization that the progress that have been achieved in Ukraine is incrementally being lost because of this funding cut. So there is a very high concern among women rights organization as per the results of this funding cut survey. So I'm going to stop here, and we can discuss the other issues that are coming out from our data in the following conversations. Thank you.
Thanks so much, Fateh, and thanks for bringing up, staff losses, but also that increased competition due to funding losses, which I think we'll talk more about when we dive into adaptation that we're seeing. But first, Olha, I hope to move to you, since the NGO Unity platform in Ukraine is a UN partner, and at the Aid Report, we've recorded deep impact to frontline caseworkers for child protection, for example. But let's learn from you. What are you facing right now? And what are you hearing from women and women-led organizations in terms of access to psychosocial or legal support or other services?
Thank you. Please excuse my imperfect English. I'm speaking from a frontline region and doing my best to communicate clearly. And thank you for your understanding. Ukraine is living in a prolonged humanitarian crisis, and I'm speaking not from reports, but from field reality. I work in Kharkiv region in frontline communities where daily life is shaped by insecurity, displacement, loose income, and exhausted. Our region hosts more than 500,000 internally displaced people. The majority are women, children, and older persons. Women are holding families together, caring for children and elderly relatives searching. Our field teams observe a clear pattern when funding decreases. The first services to disappear it's a case management, safe spaces, mobile outreach teams, psychosocial support, but needs do not disappear. They shift onto women's shoulders. We see rising caregivers burnout, isolation of older women, and loss of access to services for survivors of violence. I think this is foundational components of protection architecture, and women are the primary users of humanitarian protection services, and we compensate for some system gaps. Consequences include increased unpaid care burden, economic instability in female hidden households, isolation of older women, reduced access to services, and needs do not decrease, but responsibility shifts. Thank you.
Thanks so much, Olha, and thanks for highlighting the unpaid care and the burden that falls on the shoulders of women and girls in Ukraine. I know we're interested to hear much more from you too in terms of adaptation. But let's go now to Jolie. And just a reminder to the audience that Jolie will speak in French. So I'll give everyone a moment. If you need to switch to the correct interpretation channel, please do so now. But Jolie, welcome. Thank you for being here. The current conflict in DRC has led to a continuous and very unpredictable pattern of movement for women and girls. And I wonder, tell me what it's like trying to meet their needs in Democratic Republic of Congo right now. Hopefully that question came through by interpretation.
Merci, merci beaucoup. Merci pour la parole. Coordonnatrice de l'ONG AFEDEV en RDC. La situation de la femme et de la jeune fille, les femmes et les filles en RDC. Vous m'entendez? La situation de la femme et les filles a vraiment avancé à une intervention de précarité très élevée. Les femmes et les filles traversent des moments très compliqués depuis cette situation des coupures de financement des États-Unis. Vous le savez aussi que les États-Unis couvraient vraiment une grande partie de l'aide humanitaire en République démocratique du Congo, plus particulièrement ici à l'est de la RDC. Et vous allez trouver que les femmes et les filles de l'est de la RDC ou du pays en général traversent des moments très compliqués. Dans le domaine de la santé et protection, il y a de milliers de femmes qui ont été violées. Plus de moyens de prise en charge. Des programmes vastes étaient appuyés par le fonds USAID, les fonds de financement des États-Unis. Il y a des femmes qui ont été violées. Ils sont abandonnés ou elles sont abandonnées à elles-mêmes. La prise en charge médicale de programmes larges n'est plus disponible dans des structures de santé. En matière de protection de la femme, des femmes sont violées. Les rapports de UNFPA récents a signalé que depuis février 2025 à septembre, 80 000 femmes ont été violées. Pas de disponibilité des kits de premiers secours dans des structures sanitaires. Il n'y a pas de kits même pour prendre en charge les problèmes de paludisme. Je me rends compte que même moi, j'ai fait partie de payer même la fiche pour la consultation préscolaire de l'enfant. Ce sont des fiches que les fonds là disponibles de USAID disponibilisées à toutes les femmes dans les structures sanitaires. Et donc, en matière de santé, il y a un problème sérieux de protection. En matière de nutrition et pauvreté, il y a une pauvreté qui est élargie. Problème sévère au niveau de femmes et de filles. Et les filles, actuellement, travaillent dans des sexes et des survies, des activités de sexe et de survie pour trouver quelque chose à manger, à satisfaire à leurs besoins. Il y a eu pas mal de femmes ou de jeunes filles mères, adolescentes, je précise, qui acceptent de traverser toute forme d'abus ou d'exploitation pour survivre à leurs besoins et aux besoins des enfants. Il y a eu à l'est de la RDC des programmes d'éducation, de récupération de filles qui ont raté les cursus scolaires. Il n'y a plus ces programmes disponibles ici chez nous. Il y a deux femmes chefs de ménage qui étaient appuyées par ces grands programmes avec des activités génératrices de revenus, des agents, comme on le dit ici chez nous, et qui sont déjà éparpillées. Récemment, j'ai croisé dans l'évaluation de femmes qui me disent que actuellement, nous commençons à transporter des fardeaux. Et pour arriver même à trouver les fardeaux, nous devons nous battre avec les hommes sur le bus pour trouver celui qui est fort puisse trouver les fardeaux à transporter. Et donc, la situation de jeunes femmes et de jeunes filles est tellement en précarité ici au Congo. Et donc, en matière aussi d'éducation et d'autonomisation de la femme, il n'y a plus de programmes qui appuient de jeunes filles, de femmes pour l'autonomisation. Et donc, nous pouvons dire que même les organisations qui appuyaient les femmes, actuellement, ils les ont délaissées. Nous avons rencontré des femmes qui étaient appuyées par les organisations. Nous avons essayé de faire l'interview avec eux. Il y a un problème très sérieux de sécurité, problème de protection de femmes, problème aussi d'abri. Les femmes, il y a des femmes qui passent nuit dans des riz. Aujourd'hui, nous remarquons de filles des riz, un nombre très important de filles des riz dans le ville de Bukavu, ville de Goma, parce que c'est là que je fréquente très régulièrement. Et actuellement, je suis à Bukavu. Donc, et cette situation a une précarité très élevée et donc un impact très dévastatrice sur les femmes et les filles de l'Est de la République démocratique du Congo en particulier et du pays en général. Nous avons aussi remarqué que pour les organisations dirigées par les femmes, ils n'ont plus moyen de soutenir des femmes. Il y a un problème aussi d'accès. Il y a des femmes qui arrivaient dans la ville pour bénéficier des activités humanitaires dans des villes ou dans des zones accessibles, mais il n'y a plus d'accès parce que nous avons déjà deux camps. Il y a le problème de coupure de financement, il y a aussi le problème de guerre, par exemple, ici chez nous à l'Est. Une partie est occupée par la rébellion de M23, une autre partie est occupée par les Wazalendo. Donc, c'est un groupe armé qui est dirigé par les jeunes. Donc, il n'y a pas accès. Récemment, dans une zone de santé, on a enregistré un taux élevé de la malnutrition aiguë sévère avec des cas de mortalité chez les femmes enceintes, allaitantes et les enfants de moins de 5 ans. Donc, c'est une situation tellement précaire que nous ne savons pas, même nous, les organisations dirigées par les femmes, comment est-ce que nous allons nous comporter pour appuyer ces femmes-là qui traversent des moments très difficiles avec la situation de coupure de financement et aussi la situation que nous traversons au pays. Donc, c'est tout ce que j'ai prévu pour la première question. Merci à vous.
Thank you very much, Julie, for a very sobering picture of the lack of protection, access to nutrition, access to health, and the exploitative measures that women are experiencing in DRC. Right now, I would like to go to Abadi. Let's turn to you. In our chat earlier, you said that the cuts hit the most marginalized communities in Ethiopia the hardest, in part because funding that subsidized specialized care was eliminated. And you also shared some statistics in terms of resources lost. So can you walk us through how that is playing out in Ethiopia right now?
Thank you. This is the right time to voice for the voiceless. A year of harm, which is an impact in our 2025, was very significant. At FJ, we have witnessed the first-hand devastating impact of US funding cut on health and safety of women and girls in Ethiopia. Our experience as a field is very grounded, with the sudden funding cut cascades into systematic collapse in health system. In terms of the harm in institutional capacity, which is very capacitating, the US funding cut, which we have about 4 projects which are fully cancelled, and there are about 3 projects which has been dramatically their budget funding from source from US and other government agencies has been very significant. In terms of the US funding, about 5.7 million US grant, which is 42% of our annual budget, has been automatic cancellation of the project. As a result, the impact has been in terms of the manpower layoff, which is it accounts to 48% of our staff. It also, we were forced to merge our operational clinics and some of them to downsize to operate at least at a small scale. In terms of our partnership, it has been impacting significant partnership terminated. We have been partnered with about 633 health facilities. 332 has been public health facility, and the remaining has been non-state actors private health facility. That support is a capacity building initiative, which helps to scale the service, but due to the fund cut, the support is no more there. This means that our load as force multiplier extension service to marginalized community has been disrupted, which eroded the public trust and the agreement we have with the public as well as the private implementing partner, which this has been as a result of the one day decide which service disappeared overnight. The other impact is on the service outlets for marginalized vulnerable people. Due to the aid cut, our service has been significantly declined. In terms of family planning, 60% of our annual family planning service has been declined. 50% of a program which has been undertaking averting unintended pregnancy has been affected. About 70% of declining in client access into HIV service artery, which is highly impacted by vulnerable people. In short, the shortage of life-saving commodity and other products is also another effect of this impact. This implies the future of life-saving commodity security in terms of contraceptive, HIV treatment, and clinical management related programs are critically challenged. In terms of harm to marginalized group, it has been affected the service for those who are at risk in a humanitarian setting, in IDPs, refugees, key populations, in terms of women and adolescent girls in areas which has been operational. This is, as a result, it declines access to life-saving services. I can highlight some of the voice from the field, where our client's voice in terms of fear, instability, chartering of hope for marginalized groups in IDP as well as in key population area. Beyond the data, the deepest harm is usually in psychological readiness due to sudden interruption of service, taking away their hope, which has directly, we heard women and girls in humanitarian settings. To cite one, Gannat, she's 22 years, in Adip, in internally displaced people in Tigray because of the conflict region. She's a family planning acceptor. She came to our facility, to the area manager where facility has been, merged, and she asked a very heavy worry statement, which says that she's afraid to get her next follow-up service on family planning. She also asked the service provider on the front line at the merged clinics if it is possible to get her next supply so as at least for a period she can live without fear. This life-saving medicines is not just a protection, it is her lifeline, her hope to remain alive, stable, which cannot be feel more otherwise. The second voice could be from gender-based.
Abadi, I might stop you there so that we can get into some of the other voices for the next question, if that sounds good. But I really appreciate your intervention, and especially bringing, light to what IDPs, refugees, marginalized populations are experiencing in terms of loss of services. We're hearing, I think, across the board from our panelists today that things like mobile outreach clinics and specialized care are the first to go. And who feels the loss the most are these populations that are unreachable without that type of service delivery. So thank you so much for highlighting that. I had to cut in, and I do apologize, but I want to make sure that we get to our conversation on adaptation, just because there is a lot of interest, I think, 1 year on, to learn how communities, how women-led organizations are adapting in the wake of funding cuts and their knock-on impacts. And so this is more difficult to parse out than ever because of what a lot of our panelists mentioned, particularly Julianne. Information isn't moving like it used to, and everything from informal check-ins between international and local NGO partners to more planned monitoring and evaluation has been really disruptive. So let's move now to Fateh. Let's go back to Fateh. In our earlier chat, you mentioned to me the rise of a consortium model, but also increasing concern about competition among organizations. Can you briefly describe what you've learned about how women-led organizations and maybe the overall kind of humanitarian structure in Ukraine is trying to adapt in the wake of these funding cuts?
So, Kelly, thank you so much. I'm going to try to be brief. Adaptation is hard, and I just want to give a little bit of perspective of what I'm trying to say. Because when we look at again the data, in 2025, 85% of women rights organizations relied foreign assistance for their programmatic intervention. And when we look at 2026 estimations, they say 78% of them say we are going to continue to rely on foreign assistance. So what does it mean? There is an incremental decrease on the reliance on foreign assistance. But when we, for example, look at the finance access of women rights and women-led organizations, still 50% of them are saying that we don't have any alternative long-term funding in 2026. Only 25%, only one in four of them are saying that they will have unrestricted or flexible funding from donors in 2026. And when we, for example, ask the question to women rights organization, okay, what are the options that you are looking for to finance your program? Again, 78% of them are saying that we still are going to continue to rely on foreign assistance. What do I mean by giving these statistics? Adaptation is extremely hard because still there is a high expectation. Overwhelming majority of women-led women rights organizations are going to continue in order to reach out the most vulnerable, the foreign assistance. So this is one thing. I just wanted to give this background. And when we also look at their survival in 2026, believe it or not, or can you imagine, only 16% of them are saying that we are able to continue to operate more than 1 year with the current level of funding that we have. So very overwhelming majority are most likely going to close down their business if the funding situation doesn't change. When we look at the adaptation modalities that they are bringing, for example, in order to serve the beneficiaries, we are seeing that 70% of them are creating waiting lists or they are turning away the beneficiary, which again, it's a very, very high percentage. Again, of course, this is impacting the burnout of their staff, workload. For example, 88% of them are saying that our staff workload has increased. They are unable to recruit new staff, and they cannot also keep, there was also reference to this, they cannot also retain the qualified staff. For example, like GBV specialist, monitoring evaluation specialist. So what I'm trying to say in a nutshell, under the current circumstances, at least for Ukraine, if the situation doesn't change, it's going to be extremely hard for them to adapt to the new reality. But there is still a little bit of hope. You mentioned about, or I mentioned in my previous conversation that there is a worry about an increased competition in women-led women rights organization, but there is also a hope. They are also offering a solution to this, the consortium modality, in order to decrease this competition and also in order to utilize the limited available resources among themselves, also in order to reach out to more beneficiaries in Ukraine. So this option, for example, the setting up a consortium, applying to funding is one consortia with several organizations. It was favored in 2025 by 25% of the organization. Now we are seeing almost half of the women-led women rights organization are saying, okay, we need to really work together to mitigate the challenges that are brought by the funding cuts.
Thank
In
you so much,
2000,
Fateh. I think I'll stop you there. This was extremely helpful to hear, especially about the consortium model. And I know there will be questions about it. So I encourage our audience, put your questions in the Q&A box now for Fateh about what he just presented to us in terms of adaptation. And I know he'll be happy to answer those when we get to the Q&A. But for now, I want to turn to Olha. Already stretched organizations are unbelievably stretched from what we're hearing in Ukraine right now. So is there an example of local organizations being asked to do or provide service support without resources, maybe without authority? How do you navigate that? Give us a sense of what you're seeing in Ukraine.
Thank you. I agree with Fatih. Women organization are adapting very quickly, but the cost of this adaptation is high. In frontline communities, we see several common strategies. Organization reduce administrative costs to a minimum and redirect resources to direct services. A single space begins to serve multiple functions at once: a safe space, a consultation center, humanitarian hub, and education venue. Teams work in hybrid formats, combining online and offline support, mobile outreach, and remote consultation. At the same time, the role of volunteering and informal networks is growing. Women within communities taking on coordination of assistance, mutual support, and caregiving for children and older people. This helps maintain a minimum level of system functionality even during funding interruptions. But the key point is that this adaptation is sustained by exhausted. Women's organization continue operating through extraordinary effort, reduced salaries, emotional burnout, and instability, and it demonstrates remarkable resilience, but it also reveals the limits of the system's endurance.
Thanks so much, Olha. Thanks for giving us a little bit more of a background of what you're seeing in Ukraine. We really appreciate that. Abadi, back to you. We know how important it is to work closely with domestic government and to mobilize domestic resources to fill gaps. Are those conversations happening in Ethiopia? And what sort of incremental adaptation is that leading to? Abadi, make sure to unmute yourself. Thank you.
Thank you. Yes, we have been adapting the situation into levels, one at national level. So we managed to advocate with the Minister of Health and the parliamentarians. The intention is to make their commitment for the health program. This is in partnership with our development partners. We have been following how the budget has been allocated and how the parliamentarian, before approval of the budget, to increase at least to ask the ministry whether improvement on the health annual budget becomes an agenda of the system. That is in terms of system strengthening. Second, we try to advocate from regional platform. We establish beyond the boundaries to establish a network of like-minded in Ethiopia, Kenya, and Somali, East Africa, and to influence the regional UN, the government representative on allocation of and adherence to the map to plan of action. That is in terms of influencing the government structure. In terms of internal institutional level, we undertake structural adjustment in terms of merging services, in terms of downsizing services as a mitigation plan, in terms of survival and continuity of service. We also look into diversified resources as a donor base. We, from traditional donors, we managed to engage with Gates Foundation, with Bayer company, so as to finance the health system, especially the family health program. In terms of accessing to commodities, we try to bridge with FCDO and to mitigate the stock out of essential commodities, contraceptives. In terms of containing the health clinics, we managed to raise funding through the IPPA family and Dutch government, at least to run our clinics open for a specific period of time. Thank you.
Thanks so much, Abadi. It's really helpful to hear how those conversations are going and how you're navigating these funding gaps. To Jolie now, and a reminder that Jolie will speak in French, so I'll give everyone a moment to switch to the correct interpretation channel. And also remember to speak slower for our wonderful interpreters on the line. Thank you so much for what you're doing. One thing that stood out to me from WRC's report is that women-led organizations describe their work as multifaceted. We just heard from Jolie how much women-led organizations in DRC are trying to provide right now in terms of livelihood support, peace building, disability inclusion, human rights. Not all adaptations can be seen as positive, right? And so I wonder, Jolie, what are you most concerned about in terms of adaptation that you might be seeing, either from women-led organizations or from women and girls themselves in DRC?
Merci beaucoup pour la parole encore une fois accordée. Pour moi, je peux dire que les principes d'adaptation est vraiment loin. La situation nous dépasse. Actuellement, nous sommes dépassés par la situation. Mais vu que la population congolaise, c'est une population très résiliente, nous nous sommes dit que nous n'allons pas abandonner, nous, des organisations dirigées par les femmes. J'ai dit que la compétition est tellement élevée parce que les organisations dirigées par les femmes, elles sont à moins de 20% même représentées pour des financements directs. Nous devons nous battre, nous, les organisations dirigées par les femmes, pour voir comment est-ce que nous pouvons trouver des sous-traitances avec des organisations éligibles à certains financements. Donc, voir comment trouver des sous-traitances avec les organisations éligibles, par exemple, au Fonds humanitaire pays. Et ce n'est pas facile pour les organisations dirigées par les femmes. Le Fonds humanitaire pays exige à ce que les organisations dirigées par les femmes trouvent au moins 10 à 20% du financement local trouvé par un partenaire éligible. Pas facile. Ce n'est pas facile d'en trouver. Actuellement, avec les problèmes très sérieux, les coupures de financement, il y a des projets d'urgence de 3 mois. Avec le problème que nous avons, comment subvenir aux besoins de toutes ces femmes avec des situations de problème de 3 mois, 6 mois. Un projet d'urgence 3 mois, 6 mois. Vous allez voir, il y a une cible à atteindre qui n'est pas atteinte même. Les organisations dirigées par les femmes ont perdu un nombre important de staff à tous les niveaux. Par exemple, pour moi, à FEDEF, deux fois, je me retrouve, je suis seule au bureau, je dois participer à 4 réunions parce qu'il n'y a pas de staff disponible à cause de manque de financement. On a pris une stratégie de prendre les bénévoles et les étudiants qui sont en terminale pour nous appuyer dans des activités de sensibilisation sur les exploitations bisexuelles, sur la lutte contre les violences basées sur le genre. On les forme de cette manière et comme elles sont d'accord, elles sont capables, elles sont prêtes à faire le bénévolat, on les utilise de cette manière-là. Mais c'est parce qu'il n'y a pas de financement qui sont disponibles. Les organisations dirigées par les femmes se heurtent à des sérieux problèmes, surtout celles-là qui ont été coupées de fonds. Il y a des communautés qui menacent déjà. Il y a eu des promesses et les communautés étaient déjà évaluées. La population était déjà ciblée de recevoir un programme pertinent à leur situation et tout d'un coup, c'était coupé. Il y a celles-là qui avaient déjà commencé, il y a celles-là qui devraient aussi commencer. Mais les communautés ne comprennent pas que nous pouvons être coupés de financement. Alors, ils nous viennent et nous disent, qu'est-ce que nous pouvons faire? Vous étiez venus, vous nous avez évalués, vous nous avez ciblés, vous nous avez inscrits sur vos listes. Mais aujourd'hui, vous nous dites que pas de moyens. Il y a de femmes dirigeantes de famille, des femmes chefs de famille qui étaient victimes de certaines situations et de violences sexuelles. Et elles étaient ciblées pour recevoir de l'aide en matière d'autonomisation, avoir au moins une vache, pas une vache, je m'excuse, une chèvre, une petite enveloppe pour des activités et un peu de graines pour des activités potagères ou créer de jardins potagers. Mais tout cela a été coupé. Toutes ces femmes nous disent que vous venez accentuer notre vulnérabilité parce que on avait foi en vous. Alors, nous, les organisations dirigées par les femmes, nous avons un sérieux problème à cause du manque de financement à long terme. Pas seulement manque de financement à long terme, nous avons aussi des problèmes de compétition avec des organisations internationales ou nationales. Nous n'avons pas accès. Nous n'avons pas accès à de financement. Malgré qu'il y a une coupure de financement, il y a des petites subventions qui continuent à arriver, surtout localement, avec les fonds humanitaires, quand il y a des urgences, comme le pays est toujours en situation d'urgence, si ce n'est pas la guerre, c'est les coupures de financement, ce n'est pas les coupures de financement, ce sont des catastrophes naturelles par-ci, par-là dans la République démocratique du Congo. Et il y a toujours de petits financements qui arrivent. Avec le principe d'adaptation, nous avons opté de nous réunir dans un forum, un réseau des organisations dirigées par les femmes pour voir si nous pouvons aller vers une plateforme des actions humanitaires des ONG nationales, voir si on pourra plaider en faveur des organisations dirigées par les femmes pour leur donner aussi, s'il est dit, à 20% afin de subvenir aux besoins des femmes et des filles. Pour moi, à FEDEV, j'ai actuellement un petit financement en cours avec les fonds humanitaires. J'ai eu cette grâce en 2025 et je suis avec 6 organisations à base communautaire dirigées par les femmes. Et ces organisations me facilitent avec des sensibilisations de prévention sur les exploitations bisexuelles, le VBG et le référencement des personnes ou des survivants de VBG. Ces organisations, je les appuie avec une petite enveloppe et quelque chose de bureautique pour seulement appuyer. Nous avons trouvé quand même que ces organisations sont aussi dans un principe d'adaptation parce que, et nous ont dit que nous savons déjà que vous n'avez plus de moyens, vous qui nous soutenez. Et il y a des organisations qui ont pris cette enveloppe de $450, ils ont payé un champ. Et les femmes nous ont dit, nous avons payé ces champs parce que si nous plantons et nous récoltons, nous allons vendre et appuyer notre organisation à base communautaire. Parce que d'ici le 31 mars, ce financement prend fin. Et donc, ce sont de petits projets de 3 mois à 6 mois que nous pouvons décrocher pour appuyer des petites organisations. Donc, c'est ça le problème auquel nous sommes heurtés, nous, les organisations dirigées par les femmes, au niveau de la RDC. Merci à vous.
Thanks so much, Julie. One of the things that stuck with me, I think, from Olha was that the cost of adaptation is really high in Ukraine. And I think what Jolie just sort of painted a picture for us is the price is paid by women and by women-led organizations who are continuing to try to provide services in the wake of these funding cuts. And in the wake of the erosion of trust that happened as a result of the abruptness of the cuts. I really appreciate everyone's interventions. We are not exactly on schedule. This is my fault as the moderator, but we do want to have time for a call to action. And so before moving to the Q&A, I want to invite our panelists to think about the future. Looking ahead, what is one priority that governments, donors, humanitarian actors must act on now to prevent further harm to women and girls and to support women-led organizations on the front lines? And so I know that representatives from multiple donors and governments are on the line. I ask our participants to keep your intervention really short, as brief as possible, so that our audience does have time to ask you all the questions that they want. So, Olha, I will turn first to you. Briefly, what do organizations in Ukraine need immediately to keep women and girls safe?
Thank you. The solution do not require new models. They require stability. First, we predictable multi-year funding for women-led organization, not short grant cycle, but the ability to plan services and retain qualified staff. Sorry. Second, direct financing of local organization without excessive intermediary bureaucracy. In frontline communities, speed of response equals safety. The third is its flexible budgets that allow organization to quickly relocate resource based on realities on the ground. And fourth, it's investment in people, psychological support for teams, fair salaries, and burnout prevention. Without our people, without our staff, the system cannot function. And most importantly, support for women organizations should be treated as an infrastructure investment, not an optional social add-on.
Thanks, Olha. Jolie, back to you. Jolie, what do women-led organizations in DRC need tomorrow in order to meet the deep needs that you've done such a great job of highlighting for us today?
Merci beaucoup. Pour moi, je parlerai premièrement de la protection des femmes. Une protection qui renforce la protection physique des femmes et la prévention de violences sexuelles et celles basées sur le genre, ainsi que toute forme d'exploitation et d'abus qui sont commis contre les femmes. J'aimerais aussi parler aussi à une intervention en faveur des femmes qui soit holistique. Une intervention en faveur des femmes qui soit holistique parce qu'elles sont protégées, oui, elles doivent avoir accès à la nourriture, médicaments, abris. Deuxièmement, j'aimerais parler des renforcements des capacités de nous, les organisations dirigées par les femmes. Je me suis dit que peut-être c'est parce qu'il n'y a pas de capacité que souvent on se heurte à ces compétitions très élevées sans atteindre le financement à la première ligne. C'est pourquoi on nous amène toujours à la sous-traitance. C'est ce que moi je vis. Et dernièrement, je voulais parler que les organisations dirigées par les femmes atteignent de financement à long terme, de financement qui nous facilite de bien sauver des vies, de mener tout ce dont nous avons besoin en faveur de femmes et de filles et de nous-mêmes. vous voyez que si vous trouvez un financement de 10 000 dollars, 15 000 dollars, vous allez payer les bureaux, vous allez souvenir en faveur de personnes en besoin ou vous allez payer les agents. Et donc, ce sont le besoin que nous avons, trouver des financements à long terme et qui soient multisectoriels. Un financement qui touche quand même deux à trois accès pour subvenir aux besoins de plus vulnérables. Merci.
Thanks so much, Julie.
Thank you.
Abadi, you've described the conversations already happening in the country to try to adapt to the US foreign assistance cuts. What needs to happen next, both inside and outside Ethiopia, to make meeting the needs of women and girls more sustainable?
Thank you. The first thing what we have to do is domestic financing. Make the government more accountable to allocate higher budget and ensures commodity securities based on multiple accord. This can be done with bilateral as well as multilateral agreements, so the donor have a say to enforce the government more accountable to allocate more resources to the financing. The second is the aid structure priority, championing the local through local localization initiative. With that, we have to look into providing flexible funding, direct source, as well as sustainable tools to ensure locals are empowered to sustain their business. Third is innovative priority in terms of building long-term sustainability and beyond the grant. For us, social enterprise initiative could leverage in 2025 40% of the gap which we lose because of the earning. We make specific adjustment in our social enterprise initiative with the help of IPPF and other port donors. So my priority is to look into inward and sustainable our business with social initiative for a cause of charity wing for subsidizing the free service for the poor and underserved. Thank you.
Thanks, Abadi. Julianne, WRC's reports, I know, included recommendations, including for national and local organizations in the countries in which your research focuses. Is there shared advice that has emerged from them? Or the floor is yours for your call to action.
Yeah, thank you. And actually, I'm just reflecting, and I had a lot of recommendations that were floating through my mind, but I think what I'd like to really focus on to close my part is recommendations to the international community in order to inform what is being called a humanitarian reset. So as we know, this process has emerged largely in response to the scale of the recent funding cuts, and the process is being framed as a way to improve efficiency and effectiveness of the humanitarian system. But what's really concerning to us and what we've seen from our panelists as well is that, the reset really hasn't meaningfully grappled with the gendered consequences of the aid cuts, and these reforms that are being proposed are actually risking entrenching gender inequality within the humanitarian system further. So some services being deemed non-essential or deprioritized, we see that women and girls are bearing a disproportionate risk. So when we're thinking of recommendations for the humanitarian reset, I think we have to be really serious that this process doesn't replicate or entrench the harms, and really paying attention to not celebrating adaptations that are actually shifting a burden and not holding international actors accountable. So I guess my key recommendation and what we discussed more in the report that we've just published is that we really have to be intentional about rebuilding a humanitarian system that has gender equality and local leadership at its core. So this shouldn't be an afterthought. It has to be a foundational principle. Gender responsive programming in humanitarian crises is not a nice to have or an add-on. It's really life-saving. assistance. So protection services, sexual and reproductive health care, women's economic empowerment, these programs save lives. And when they're treated as expendable or a nice to have, we see clear evidence that women and girls die. They lose their lives. There are all these carry-on impacts that are yet to be seen, but we know that they will happen and we have the evidence. So in order to have true, I think, local leadership at the center, this means genuine power sharing, not just burden shifting, not just, quote unquote, localization that actually places local organizations at an unfair advantage. We really need to do a better job at working in partnership with feminist civil society and ensuring that the reset institutionalizes the leadership of impacted communities. And last, it also means accountability. So we need to invest in mechanisms that monitor commitments on gender equality and really holding actors accountable when funding cuts happen and that when they lead to harmful practices and impacts for women and girls.
Thanks so much, Julianne. That concludes our moderated panel. Just a few minutes over, but we have plenty of time and a scheduled allocated time for questions. And also just a note to our audience that we have folks here who can speak to more global or general questions about Women's Refugee Commission, the International Planned Parenthood Federation, or UN Women. So if you have questions to pose to those organizations more broadly, we can accommodate those as well. But bear with me while I move on over to our to our Q&A box to see the questions that have already been submitted. Yeah, Shannon Riley asked, this is a question for you, Fateh. Would love to hear more about what you meant about the competition of women organizations. Was this in reference to the pool of donor funding? And Fateh, I see there's also a question about the consortium model among women-led organizations and what was the source of the consortium funding. So perhaps you could take both of those.
Thank you. So yes, it was a reference to the shrinking funding space in Ukraine. In Ukraine, we have a Ukrainian Humanitarian Fund. It's a country-based pool fund. Although the share of women-led women rights organization is increasing, which means like more women-led women rights organizations are able to access this funding over the years. But now that funding is becoming less and less. So which means the actors, the organization, women-led women rights organizations are going to compete for the less amount of funding. So this is their statement that they are very scared or they are experiencing the competition among them in order to utilize the funding, in order to access the funding in Ukraine, especially for Ukrainian Humanitarian Fund. For the consortium model, I mean, the logic, of course, why are they proposing this? Why there's an increase? Because they also understand that now there's less amount of funding, and I have also briefly touched upon, like they are losing their qualified staff, they are losing the specialized staff on GBV, meal, information analyst. So they are proposing the consortium model. So even like one of the organizations become non-operational due to funding cuts, at least the consortium model is going to pool the resources and continue these specialized services like GBV, MHPSS, monitoring, evaluation, and etc. The second thing that they are, of course, supporting this model is it protects smaller grassroots women organization to be wiped out entirely from the system. So they are also thinking that consortium is going to work as a protection mechanism for women rights organizations themselves. And also, like as I mentioned, specialized staff and technical capacity can be shared across these organizations. Even if one of them lose those staff, then the other will have, so they can utilize these sources collectively. And the last thing, uh, it strengthens their collective kind of negotiation power. Because dealing with one donor is a different story, but dealing with one donor together with 5, 6, or 10 women-led organization is a different story. So they think women-led organization think that it's also giving them an advocacy power when they negotiate with the donors. So that's why, in a nutshell, they are supporting this idea. Over.
Thanks so much, Fateh. We have another question here that I think gets to something I was thinking about in terms of, we've been talking a lot about funding shrinking, of course, and we've heard that from all of our panelists, but what are the top 3 most impactful ways to further support women-led organizations so their voices genuinely shape health priorities and decisions that lead to greater impact for women and girls? And this participant is asking, more funding would help, of course, but what else specifically? So maybe could we go to Jolie first for your take on that question?
S'il vous plaît, je n'ai pas bien capté. Je m'excuse si vous pouvez juste répondre la question, s'il vous plaît.
Yes. What are the top 3 most impactful ways to further support women-led organizations so that their voices genuinely shape health priorities and decisions? More funding would help, of course, but what else specifically?
Merci beaucoup. Pour les organisations dirigées par les femmes, les 3 façons qui peuvent avoir plus d'impact pour les soutenir ou pour nous soutenir, comme j'en fais partie, c'est de nous aider avec le plaidoyer. L'aider pour les organisations dirigées par les femmes. Nous avons des capacités, mais je peux dire que des fois, il n'y a pas une confiance envers nous. Nous avons des capacités. Nous sommes plus affectés par la situation des femmes, de filles, je peux dire plus que peut-être d'autres personnes. Nous savons bien de quoi il s'agit quand une femme traverse de problèmes de violence sexuelle, de problèmes d'abus, de toute forme de maltraitance. Nous avons le pouvoir de le faire, mais si on peut nous aider avec de plaidoyer, et dans ce plaidoyer, qu'il y ait des capacitations, parce qu'il y a des organisations dirigées par les femmes qui n'ont pas de capacités techniques et institutionnelles. Donc, moi, j'insisterai sur le plaidoyer sur les organisations dirigées par les femmes, nous octroyer des financements directement. Des financements à long terme qui soient directs, pas des sous-traitances, même si ça peut être un consortium, mais on s'est dit quand même, c'est nous, les femmes, nous sommes là, on nous a fait cette confiance de travailler en faveur des autres femmes, des filles, avec des programmes à long terme. Parce qu'avec des projets de 3 mois, 6 mois, j'ai de l'expérience ici chez nous, je vois comme si c'est des saupoudrages. L'impact, il n'y en a pas. Le problème est vaste. Ouais. Des fois, tu mets en œuvre un projet et tu te sens, qu'est-ce que je dois faire? Qu'est-ce que je dois faire pour répondre aux besoins de ces personnes qui viennent derrière moi? Donc, j'insiste vraiment sur le plaidoyer, le renforcement des capacités et nous doter de programmes à long terme de manière directe. Merci beaucoup.
Thanks so much, Jolie. I was hoping also to turn quickly to Olha for her response to this question. And Olha, I can repeat the question if you'd like.
I think it most importantly support for women organization in our I don't know how this tale in our capacity, because we need more more psychological support and burnout prevention, and we must see another side and understand that we not alone, and it's a more global problem, not only Ukraine.
Thank you so much. And Oha, I think you've done a wonderful job of oh, I'm hearing the Spanish translation now on the English channel. I don't know if anyone else is hearing that. That was actually really nice to hear. But thanks so much, Oha, for explaining to us, and I think letting us get a better sense of what it feels like, and the burnout and the stress and just the kind of the everyday feeling of being on the front lines in Ukraine. I know that's one thing that I'll really take away from this event, and I really appreciate you sharing your perspective. I have a question that I think we may be able to split between Julianne and Abadi. But Julianne, this sounded like a question for you, whether you examined how countries are continuing their programming after the funding cuts. And it's interesting because we didn't get to you when we were talking about adaptation. And I know that, you in your reporting recorded different coping mechanisms and ways that organizations were continuing. So perhaps that's something you could expand on now.
Yes, I mean, that was an emerging finding from the evidence that there are, of course, these adaptation mechanisms, which our panelists spoke to. But honestly, there wasn't much evidence of it, probably because, we're only not even 1 year in at the time that we did the scoping review. So I think one other, coping mechanism that we found was, and whether it's a positive one or not, but anyway, just showcases, I think, the resilience of frontline organizations, but not even formal organizations. These are grassroots kind of collectives that are really filling the gaps. One very notable example that I think a lot of us have heard about are the emergency response rooms in Sudan that are very much a woman-led effort to kind of provide, just really, mutual aid efforts in a very, very challenging circumstance. I think it's hard, because of the lack of resources, then we're asking people to do even more to document what they're doing. So I think that's just a conundrum where it is so important to document what's being done, and something we're hoping to do actually this year, to really see what efforts are being made, not just in looking at it as adaptation, but looking at it also as what kind of funding mechanisms can be leveraged to have a greater impact. What kind of funding from international donors and others can be most effective to filling the gaps for women and girls. So I think that's something we're really interested in exploring further. But yeah, that's what I can say there.
Thanks so much, Julianne. And you sort of answered this, how can we ensure better documentation of the impact of the funding cuts? This is something, of course, that at the aid report, we're continuously grappling with, not only because we don't want to burden organizations that are really struggling to adapt, but also because there is a lot of fragmentation of evidence. It is really hard to understand what is going on right now. But Abadi, do you have a take on this of how can we ensure better documentation of the impact of the cuts, and perhaps how do we better share that with others who can learn from the experiences, in Ethiopia, for example?
Thank you. In terms of documentation process, in the country, we establish what we call SRH forum. is a new forum, which is led by the Minister of Health. On regular basis, we'd have a review meeting. Every SRH players on the field reports what's done, what they are doing, what they have been doing. So the government, usually the Minister of Health, captures those data and make it analyze. Before, I think 3-4 days ago, we undertake half-year review meeting on those specific areas. So one thing is the government helps us to coordinate among SRH players on the field. Second, lessons from each field has been documented and presented on those platforms. Third, to map out what are the players on the field and so as to cooperatively operate on the same field. So one thing, it helps us to identify the best practices on the field. One, we can replicate on the field and to see what are the real impacts on the assessment. There are some specific assessment carried out by the government as well as other SRH forums. We also have what you call CORHA, which is Consortium for Reproductive Health Associations. There are about 78 implementers, RH organizations. So we streamline our reports to that venue, so they consolidate and present the case to the government. So what are the gaps, what are the implications of it? So I think one thing the government has to step up to record the impacts on the field. Despite the individual organizations, the collective effect on the country has to be documented to strategize the national policy as well as the national direction frame. Thank you.
Thank you so much, Abadi, for emphasizing the importance of kind of that collective data collection on a larger scale to give us all a better view of what's happening in individual countries. We are out of time. I can't believe it. We did not get to all of the questions. I do apologize for that. We got to as many as we could. Thank you so much to our audience for asking them. Thank you. A huge thank you to our panelists for being here today. These impacts, as we've learned, they're not hypothetical. They're already reshaping lives, they're reshaping systems and futures right now. And I'm really thankful to all of you for helping us to better understand them. Thanks.